Hi, this is Nurse Angela with Angela's Nurse Educators Toolbox. I have another activity that would be really helpful. We do this one sometimes in post-conference, sometimes in lab. We call them curveballs. It's called What Would You Do If? So I have this all uploaded in my Google Drive under clinical activities. So for example, there's medication scenarios. What would you do if a patient has a severe allergic reaction to a medicine you gave? What would you do if a patient becomes tearful and states they feel like a burden to their family? What would you do if a patient's family member demands information about the patient's diagnosis but the patient has not given consent? What would you do if a patient's blood pressure suddenly drops to 80/50? What would you do if you were short-staffed and you had multiple people calling for help? What would you do if you suspect a coworker is impaired at work? What would you do if a patient insists on leaving the hospital AMA despite being unstable? What would you do if your patient's IV pump repeatedly alarms? What would you do if a patient confides in you about experiencing domestic violence but asks you not to tell? So this kind of helps enhance clinical thinking skills and clinical judgment for real life things that happen, because nothing's perfect in nursing. We have things that happen that aren't by the book all the time, and we have to think on our feet. So doing these in post-conference after a clinical day makes the students really start to think, what would they do? And you can talk about it in groups. So this was a great little activity. We also do it with lab. You know, what would you do if you put a Foley in and your patient still states they need to urinate or feel like they need to urinate or it's not emptying? All those kind of little things to get them thinking, what would they do? Because we need them to act, not just assess, but they need to have some type of intervention. I hope this activity helps. Good luck. If you like, subscribe to my channel.